there.
There's nobody home. Okay. What's that?
Mary texted me, she was.
Waiting for others.
If they want.
Okay, well, we're gonna get started and hopefully Mary can join us. Progress. Angie, can you do a roll call?
Sure. Mark Cooey.
Here.
Gary Manning. Mark Gill.
Here.
Mary Miller. Pat Ripshin.
Here.
Sandy Kramer.
Here.
Have 4 out of the 7.
Great, thanks Angie. And was this posted properly?
Yes.
Great. Okay, and we need approval of the agenda. Can I get a motion?
I'll make a motion.
I'll second.
Great. All those in favor, say aye.
Aye.
Opposed? Okay. We have approved agenda. And then the minutes of July 21st. Anybody see any corrections, additions, any issues? Okay, not having heard anything, we'll just call those good. And public comment. Anybody online? Hello. Here we are. So, okay, well, I don't hear anything, so we're gonna move on to the census recap.
Right, so we are at our actual highest number as of today. We are at
Yay.
73 with one in the hospital, so when that person comes back, we'll be at 74. And it looks like we're gonna try to maintain that. And then the CVRF average about 14, because we did have a couple hospitalizations, but they are back to 15, I believe.
Wow, great. Good to hear. And okay, we're ready for the financials. Actually, it looks like you're in Mary's seat there.
I'll be going over.
Or
that.
are you doing that? What's that? Okay.
Yeah. So you guys have the financial packet. We are below this month at 34.32. It's good. Cash receipts, and we are at a good standing at falling at 289,535 towards the end of our month. Basic things, so the credit card statement, the biggest things we'll see is that we have a CVRF classes, and then we have the med tech classes, CNA classes. We are paying for a backup, which is our medical records and transitioning over to Matrix, so that's a monthly fee of $455, which is our requirement. We have to maintain records for 7 years per state federal regulations. And then just the main things to focus here on, check numbers would be check number 452, which is our clipboard health, which is that agency. And again, you'll see it again at 469, which would be that clipboard health. So mainly the biggest expenses right now, aside from our overall maintaining expenses, would be that agency invoices. Otherwise, there's not much to report on major spendings, just our normal spending. And then obviously we have the check number 497, which was Angie Alexander coming to do some DON training with Jesse, our current DON.
Great. Okay. Next, accounts receivable.
Accounts receivable, it looks like we have actually been able to make headway on some of these. Again, there is that one that's on line 20 that we are looking. We have a message out to Mike Window regarding these, and then the liens that we have, just making sure we are receiving payments. And then there was some Medicare portions not being paid, just late filing, or incorrect claims, which should be paid in full.
Okay. Questions on that? What are cash flows?
Cash flow looks good. We're at 34 points. 34.32.
Oh, wow, it's getting better and better.
It is.
Here,
Looks like you had a pretty good month.
Yeah, wonderful. And that involves, getting that census up and being able to build those. And
are we hiring nurses yet, or how's that going?
so I did submit everything, like I told you guys the last time, to Trish. Trish is just waiting for that test to return some additional information, but we should be anticipating that soon.
Okay, great. How many contract employees do we have then?
I mean, it really depends. Right now, we have one person from Grape Tree that we're utilizing, and then we kind of vary between a few of them off of Flipboard, depending on who picks up. But we've been pretty fortunate about being able to have the same rotating people over and over again. A lot of people come in, love our building, we're trying to convert them over. But obviously, with the wages where they're sitting at, hopefully we'll be able to make headway.
Good. How about our vouchers? What's the?
We just, yeah, we went over the check numbers.
Oh, those are it.
Just the main ones, like I said, there's not really anything out of the ordinary in which we don't pay for on a monthly
Okay.
basis, aside from that clipboard. But otherwise, there's nothing, and then the Grape Tree, those are the main ones, and then it's just our maintaining cares, like our matrix, just our EMR, and then our Alliance. We did have the John Sterling and Associates, which is our Medicare cost reports and Medicaid cost reports and our audits.
And then you talked about the aging with Mike Window, basically
Yeah.
some of the liens that are outstanding, so.
Yep, so those liens remain in effect until obviously we get paid. It's usually on a piece of property that they have, so whether it be a home or whatnot, so that in the event of somebody unfortunately passing, then we would obviously remove our money first.
How long do some of those take though? If probate.
Go to probate, it can take time, but essentially, they obviously want to make sure medical bills are taken care of and making sure that's taken care of, so it could go to us and then dispersed out afterwards.
Okay, so how about our administrator's report? Update on the pharmacy.
Pharmacy is starting to make headway in, had several, meetings with them, we've gotten our cards already. They're coming in tomorrow, no, Wednesday, I think today's Tuesday. They're coming in on Wednesday to meet with the staff. Just gonna go over our processes, they're gonna anticipate being ready to come in on 9/1 if need be, but otherwise we have until mid-September with our current pharmacy. So that's actually going really well. Water project, we'll be updating, executive finance and, county board, but it sounds like they actually don't need a whole new reservoir. We don't need any of that. It looks like, based off of the new inspection, there's just minor things that need to be completed. So I should have that by the end of this week, which is videos and pictures of the new inspection. And then state surveyor, we had our IJ, which we were in compliance immediately. We had our revalidation. We did a bunch of education, and I can safely say we are in compliance.
Great, great. And going back to that water project, did we ever get the solar panels on there so that, remember we had the battery issue or whatever, and we were gonna replace that with a solar panel so that we didn't have, because Chad was saying he had to dump water and had all kinds of problems with that. So I know we talked about.
Yeah, and I signed the quote, but again, there's a lot of things that, we sign and we get the permissions to do things, and they just take a little bit extra time, so.
It has not been.
It has not been done as of now, no.
And it's sort of interesting to me that we spent all this money on this water project study and looked at city water and all these different, rebuilding the reservoir or a tower, and now we don't need to do anything. That's,
I have minor things to do on the end.
well, I just, okay, we don't, not
Very
any,
little.
yeah,
what
compared to
we're
the
doing.
$1 million project that we were looking at, it just strikes me as interesting that we spent all that time and what was it, $15,000, Mark, for the study? It was like, you know, the park,
Yeah, to do the work, right, to figure out how to fix
Just to
them,
do the
to
project.
fix the problem and,
and it turns out we can do it just,
well, I think it shows us something, right? Well, let's go find out first before we think we got the sky's full, right?
Right, and they were going off of a 2018 report versus, because we have to have it inspected every so often
Right.
due to state and federal regulations that state that we have to do so much to these reservoirs if we have our own private water source. And I'm assuming it was done, and maybe they already did the cosmetic fix to it. And that's why the 2018 report looked much worse than what the actuality is, because we already fixed the problems, the main problems.
of course, we had no record of the report or, you know, so the whole thing
Which
was,
had, otherwise we would have gotten cited on it before if we didn't have the inspection and the upkeep done to
Right.
it. So my understanding, and I can make an educated guess here, is that the reports have gone MIA. Like a few other things that have gone MIA in the building, just kind of.
Disappear.
Exactly, so that's my educated guess.
okay, we'll run with that and we're not gonna have to spend, money for city water and all the rest of it, so that's all good news. That's a great
And
thing.
our sprinkler system's already set up with the reservoir we have, so we'll do that as well.
Another thing, we should look into what the electric costs to get electricity up there. I get a solar thing as a option, right? But
Cause they got batteries now and they have to replace the batteries and so,
I don't know what it would take, you know, I don't know how much it would cost.
well, that's a half a mile.
Yeah, so it's gonna be plenty, but
Pricey, but if we can do it with the solar, which we talked about, was it like $4,000 or something?
Yeah, $4,800 and $75.
Okay, so yeah, so I mean that, if we can do that and have solid and a battery backup that we're constantly charging, I think that's a great solution. So that's why I'm always curious.
if it works, that's
Correct.
my only thing is how well does it work? You know what I mean? I don't know. I can't answer that.
Guess we'll have to
It's,
test the
we're
theory.
gonna find out.
Okay, well, that sounds good. Anybody got any other questions? Did Perry ever join us? No?
No, it does not.
Okay, well, anything else from anybody? Okay, well, this is my last meeting. It's been fun and I've enjoyed a little bit sharing these meetings. So, but yeah, and I wish you all good luck and yeah, and I feel good about where we are now. And we're gonna get this other report now coming up from our architect that, now they came there and they did this survey, right? The whole
Yes, I
facility.
actually have, well, I had the Medicare one, or Medicaid, so we're required to do that too through Medicaid for them to resurvey and do our depreciation as well. So I have a report on that that I can share with you guys.
I guess I'm talking about our architectural firm is looking at all of the
Building.
facility, yeah, I mean, and then I guess I was mostly concerned with the heating and, you know, these on the roof, replacing these.
So, yeah, Winona, yeah, it was Winona, came out and gave us a completely different quotation. A much cheaper one.
Okay. And then as they break down, we can replace them or fix them or, you know.
Correct. So it sounds like the previous company, which is, I'd like to change the contract on it eventually here. I've been changing a lot of contracts to get things cohesive, because we have two different fire protecting services, one that does the monitoring and the smoke detection, and then we have some that do the annual and the semi-annual and the kitchen. So I'm removing the one that does just our annual and combining everything under one company, including the monitoring system. It's cheaper. Plus, I've worked with them before. They're really good to work with. So I signed that contract. So everything should just move over to them. They'll put their own like monitoring equipment in there. So that'll save us some money there. And then my plan is to hopefully transition our heating and cooling repair people, which is currently trained to a different company just because they're overly expensive. And we had other people come in and be able to quote us something that's cheaper, but it's obviously that's maybe a little bit more of a work in progress to figure out.
And that sounded so expensive, because how many different units were on the roof or whatever, it sounded like.
They're all in single units, aren't they, for each room or something? Isn't that how that works? So that.
Yeah.
Of course, every room, people are, there's a lot of drastic differences, I would think, in your work. Because, somebody's cold all the time, somebody's hot all the time, whatever.
They all have their own thermostat in their room. So they're adjusting
Control
temperatures.
Yeah.
Exactly.
Well, one thing, and since I've been on the board, is what kind of amazes me is we have a company that does the courthouse, we have a company that does this, we have a company that does this. I don't really understand how we can't just get one company to, to do all of it. And I'm not saying which one's right or wrong as far as what company to use, but, like we use 2 or 3 different ones here in this building. And just, to me, when you can bundle everything all together,
Sure.
usually it works out better for everybody. So,
Yeah, you get cost benefits and you get efficiency benefits too, so
yeah,
The paperwork alone and making sure that we have all these things for when state comes in, because we were missing our semi-annuals because who do we have? Omnitech. They have it in there that they do our semi-annual, but that was a mistake. That was a typo on their end. So they weren't coming in and doing our semi-annual, so we got cited on that because they weren't doing their end, because that was a mistake.
Wow.
It's not supposed to be put in there.
But it sounds like you got so much to keep track of, Brittany, I mean, goodness, I mean, that's just, it's a lot.
well,
So,
just the rules that you have to keep track of to make
Right.
sure all those things are done.
All the
Bad
regulations.
enough you gotta have the things done, but what's the schedule for all that?
Right.
That's.
Great with the new company. Well, it's not really new to us, but with Ahern, they put us on a rolling schedule. These are the dates that you're doing it. We just schedule it. We come out and we do it. We don't even have to think about it. They just do it for us versus I have to track down the other one. And then they wanted to charge us $2,800 to do a semi-annual, whereas Ahern was willing to come out and do it for $1,200. So
great.
what do I do? Apples to apples. I'm gonna do something cheaper that I know works really well with the company and stays on task and gets the things that we need done.
That's what
That's how-
Ahern does. We
Correct.
use Ahern too for our fire protection stuff.
It just takes the guessing, it takes the having to remember when things have to come out. It just takes all that away and then you get the paperwork right away. You don't have to wait on it. So it just made more sense to me just to pile everything into the one.
Oh, yeah, so it sounds like we're making some real gains in efficiency, and that's gonna show up on the bottom line. And it's also, your job is gonna get easier and easier as these things get taken care of. And now you've got a regular schedule, you know what's coming when, and we have reports and documentation of the things that we're doing and we've done. So that's, like I said, it's gonna get easier and easier, is my opinion, so.
And the money's on the positive side of it, last 2 months. So that makes life easier too when you're on the positive side. But volume, in my world, we talk volume, but it's the same for you as patients. Fixes a lot of other things, right? So when you're closer to full than you are closer to empty, life gets a lot easier. So, yeah, I mean, in money part, it doesn't get easier as work, but it gets easier as the money part of it. That's important. So it's good that you're focusing on keeping that census upwards, where it's helpful for everybody.
And that's our main focus too, is we're looking at the financials and how that's all going, so. And I think we've made great gains from last year, the money we kicked in, was huge. And this year it's gonna be, I think, less than half of that, and I think that's a big story, and so often we don't tell our success stories, all we hear about is the problems and the drama, and the successes don't get any kind of billing, basically. And I think that's a huge problem, because people think that it's only about the drama and the challenges or whatever. So, I hope Trish puts stuff more, a lot more information on the public, so that we're doing a lot of things well, but people just don't know.
Right, and I really think that these meetings are fantastic for us to be able to tell our success. I mean, we had a really good month and we continue to have really good months. And it's because we have such great workers out there currently. We have great management staff out there, you know.
Fantastic
everybody-
facility too. I mean, it's a fabulous facility, so.
Well, it's changed full circle from where it was about 2 years ago.
Correct.
I mean, it was in a rough place a couple of years ago, and it's definitely, you weathered all them storms, right?
Right.
Whatever you want to call them, but you can see that, right? So you don't have a real labor problem anymore.
We're still kind of fixing, we still need, you know,
Little issues to
a little
fix
bit of
as
that
well.
wage issue where our nurses are being underpaid. That's something that's gotta be addressed.
But it's on the radar, right?
Yeah,
It's not
and it's-
being left, you know, now it's just a matter of solving a problem, right?
Correct.
Adjusting whatever needs to be, and but it's there. It's
Yep.
known, it's right there. There's no one talking about it over here, not selling it.
Yep.
Say it to anybody, so now it's just a matter of fixing the problem. But what I would say is, it was a pretty tough time 8 months ago. You know, just the way everything was operating, the way things are going. And people got put into some places that, I'm saying any names, but got put into some places where they just had to react, and thank God they did. You know, and to me, it really turned it around. So keep up the good work. You guys are doing a great job.
Yeah, here. Yeah.
That's got to benefit. You guys should start volunteering out there.
Brittany, have you, received any requests for people moving from Sauk County home to Pine Valley?
No, so South County kind of put a halt to their sale. So Aria Healthcare is no longer taking over at this point, but I know that there are some pretty upset staff members. I know they lost their administrator, their DON, and quite a few of their staff members. I have not seen anything from Sauk County yet. That doesn't mean it's not gonna happen, because obviously selling the home is something on their radar and what they want to do. So I can almost guarantee that if a corporation were to take them over based off of my history and corporations, that you'll see that a lot of them will transition out.
And patients too? Yeah, that's what I was wondering, if some of the patients would come this way, because there are some patients, their families live right on the line.
Yeah.
Between our county and Sauk.
Guess we'll have to expand.
Yeah,
That's left.
I was wondering if that was gonna affect Pine Valley at all. But yeah, you're right, they're on hold right now. But the county is definitely adamant about selling that home. So
Yeah, I
it's
watched
gonna
that.
happen.
I watched their residents and staff members had gone there, and this county board member, the lead, I think the chairman, did not have a very good response and very scaffold. It was just very embarrassing time for Sauk County.
Yeah, and half of the residents that were there, that were able to be transported out there, they didn't even, the board didn't even give them a chance to talk to them.
But that it wasn't, they weren't selling and there was no discussion and worked out. So it's really unfortunate.
The new one they built is what they're gonna sell.
Yeah, the one right outside Reedsburg there on 33.
They
Highway
tried
County
to,
Gate.
they had it, and I don't know if they'll necessarily get anybody to purchase or to manage that building just because they're not willing to sell the building as a whole. They're pretty much saying, here, you can rent this building and run it for us. It's kind of how, when I looked at it, that's how it looked to me, that they wouldn't actually sell it and kind of be like a leasing option to them.
That's no good either.
What's today's conversation?
Yeah, they're in receivership over there. Yeah. And I think a lawyer is managing that company and has to find somebody to take over for them. Which is good for them. They needed that.
We got a stable place right here, so that's, you know, and that says a lot, that you know, and this is a place where people can say, hey, there's good care here, we got state leadership, and, yeah, it's a win, so hopefully, you know, we can even see higher censuses in the future, so.
So what causes this to happen? These places that get, you know, like Muscatay's turned over quite a few times in the last 10 years. What's the main cause of that? Just the way they operate, or is it just
It's the ownership.
the ownership as far as what?
So how they run things. So, Muscadet, I have worked there before in their business office and just trying to get, you know, their basic essentials and their basic needs over there to take care of their patients, was non-existent. You had to fight tooth and nail to get that. And then not to mention your staffing, when you bring agencies in, it was a very toxic environment over there. And instead of fixing the issue, they just let it go. And I mean, they lost Bedrock alone, has lost all their Wisconsin buildings, almost the ones that they didn't physically own. So they're leasing their building, Golden Living Communities currently. So they were able to kick them out. But there's a lot of work that needs to go into that building, so they just
Sure, it's
take
good.
that time to put money in, make the building better. So unfortunately, it's just, you know, your leadership styles, what are you willing to put in and invest into your building and to your staff? And, you know, unfortunately, Better Off wasn't able to do that.
Basketball just kind of say free. So
Money, it's money.
It's a bottom line. It's,
Yeah,
bottom
I think
line.
the money part of it,
But they
but
operate
some
off-
can make it, and some can't. There's a difference there, you know what I mean? So there's,
a lot of corporations, they have a lot of sister buildings, so they can operate a lot longer in poor conditions and not putting that time and energy into other buildings that they need. So they can still live and collect their money from bigger buildings versus smaller buildings that can't make it a census, and the community level is much higher than they were, you know, what they're anticipating, but hopefully they'll be able to turn that around over there.
is that one that you came from, was that you?
Heartland.
Yeah, that was
Blacker.
Flacker.
closed
That
down.
was there for a long time.
Yep, and they transferred a couple times too, and then Truesdale is the one that took over from them, and they were based out of Tennessee. And they had buildings in Ohio and Florida, and eventually they ended up selling their Tennessee buildings. And then that's kind of what was their demise to, you know, having to sell and close other buildings, just make it, you know. You can't make it if you don't have a bazillion buildings, because of how they run businesses.
and that the county provides some stability, and, you know, it's not like, you know, you're not making money, we're gonna, you know, dump you or something, you know what I mean?
Right.
So it's a different mindset
Uh,
when it's a county owned versus a corporate, so. And, so, yeah, but.
There isn't many county owned ones left.
There isn't, and a lot of them are, you know, jumping ship because obviously you got your 2027 changes to Medicaid and what that's gonna look like for the future. You know, a bunch of them are jumping out before we even see what that looks like, which is unfortunate. You know, they have 2 years to make a decision if that's gonna actually go through, or if they're like, it's not gonna work out very well. So they have time, but a lot of it's just more about your eligibility and whether or not you're gonna qualify for it, or can you get a job and do those things? Is kind of how I'm interpreting.
And it's hard to imagine they're gonna do this draconian change that's gonna devastate so many people, especially with the election, you know, there's the midterms between now and then. So, you know, I mean, and if they hold to that, boy, people are gonna be so upset, and, I mean, and where are they gonna go? I mean, just where are, you know, I mean, seriously.
Yeah, I don't think there's a lot of cuts coming into it, like, as in, is it going to affect nursing homes? I think a lot of it's going to be that eligibility, how often you have to apply for it, and then who's going to be eligible for it.
As far as what,
Income, legal United States Americans, because right now, a lot of Medicaids allow for illegal immigrants. The only reason I know that is when I worked, I ended up overseeing a few buildings in the business office. We were able to get an illegal immigrant on Medicaid for emergency purposes. So there's gonna be a lot of indications of what's going to make people up, which is unfortunate. It takes away a lot of relief wise.
But I would agree that when you're in election, there's a lot of talk and then the talk gets calmed down and heard and it starts, and hopefully that's what happens.
Yeah. I think the same thing. I think that, look, really, they're gonna just, crush so many different, Medicaid. So many people are on Medicaid and it's, just to kick so many off, I think, devastating, to folks. It's not right. So we'll have to see. But anyways, we're doing a good job and, we've got to keep it going. So anything else? Okay, I need a motion to adjourn. Okay, Mark is seconded. Great, thanks, everybody.
Thank you.
And, yeah.
Thank you, Mark.
Right.
Thank you.
Enjoy your